Well, after a diagnosis of breast cancer, many women have surgery followed by chemotherapy and radiation. But a new study shows that if it's caught early enough, women might be able to avoid the chemotherapy. VOA's Pearson has more.
Since she was diagnosed with breast cancer last April, Amy Adam values family time even more.
When it comes down to it, family is what matters. And so they all kind of came together and made sure I was taken care of. It's my medical journal.
Adam was lucky. A mammogram caught her cancer early, when the tumor was just 3 by 4 millimeters, smaller than the size of a pencil eraser. Her treatment? A lumpectomy, followed by radiation.
No chemo. Did not have chemo.
At the University of Missouri Healthcare, Dr. Emily Albright says more women with early-stage breast cancer may be able to skip chemotherapy. A study published in the New England Journal of Medicine shows that genetic testing can determine the likelihood of the cancer returning. The study found women with a low risk of the cancer recurring didn't benefit from chemotherapy. Women with a high risk of recurrence do better with chemotherapy, but doctors didn't know how to advise women in the mid-range.
The recent results have clarified that for women at intermediate risk of recurrence, the majority of those do not benefit from chemotherapy.
Most people know that nausea, hair loss, and fatigue result from chemotherapy, but chemotherapy can also cause heart and nerve damage. The study could spare countless low and medium risk patients whose cancer is caught early from having to endure chemotherapy.
As we learn more about the biology, we're able to tailor treatments to the specific type of tumor that a patient has. So there are some small tumors that may be more aggressive, and there may be some larger tumors that are less aggressive.
Screening was key in catching Adam's cancer early. Mammograms can detect a lump 2 years before a woman can even feel it. Adams says it was a huge relief not to have to undergo chemotherapy.
Yeah, come on back. How are you today? Good.
Because of this study, more women will be able to get treated without its negative side effects. Pearson, VOA News.